Welcome back to Beyond the Microscope, exploring human health. Today we're going deep on a condition that's often called a silent killer, the abdominal aortic aneurysm.
Right.
You've probably heard the term,
Yeah.
but do you really know what it is and why it's so dangerous?
It's a great topic to dive into because, like you said, it can be incredibly dangerous.
Yeah.
But often people don't understand the severity until it's too late.
Exactly. So let's start with the basics.
Yeah.
For someone who's hearing about this for the first time,
Okay.
how would you explain what an abdominal aortic aneurysm actually is?
So imagine the aorta,
Okay.
the largest blood vessel in your body,
Hmm.
like a major highway for blood flow.
Okay.
It runs from your heart down through your chest and into your abdomen.
Okay.
An aneurysm happens when a section of this highway, specifically in the abdominal area, weakens and starts to bulge outwards.
So it's almost like a weak spot in a tire that starts to balloon out.
That's a great analogy. And just like a tire blowout can lead to a serious accident, a ruptured abdominal aortic aneurysm can be life-threatening.
Yeah.
That's why understanding this condition is so important.
That makes the silent killer label even more unsettling.
Yeah, it is.
What causes these aneurysms to form in the first place?
Mhm.
Is it just wear and tear on the body over time?
Well, age is a factor.
Okay.
It's not quite that simple.
Okay.
One of the biggest culprits is a process called atherosclerosis.
Okay.
This is where fat and other substances build up on the inner walls of your arteries,
Yeah.
much like plaque buildup on your teeth.
Right.
Over time, this buildup can weaken the artery walls, making them more susceptible to bulging.
So the highway gets clogged, weak,
Yeah,
and then starts to bulge under pressure.
precisely.
Right.
And things like high blood pressure add even more stress to those already weakened walls, increasing the risk of an aneurysm forming.
Now, you mentioned age being a factor.
Yes.
What are some of the other risk factors that people should be aware of?
Age is a big one, as aneurysms are more common in people 65 and older.
Right.
But the single strongest risk factor is tobacco use.
Oh, wow.
Smoking significantly weakens blood vessels, making them far more prone to aneurysms. It's a huge concern.
That's a powerful statement.
Yeah,
So quitting smoking should be a top priority for anyone wanting to reduce their risk,
absolutely.
even later in life.
Absolutely.
And it's not just about age and smoking.
Right.
Men are significantly more likely to develop abdominal aortic aneurysms than women.
Yes, that's true.
Additionally, your race and family history play a role.
They do.
White people have a higher risk.
Yeah.
And having a family history of aneurysms increases your chances as well.
Yes.
So if you're a man over 65 who smokes and has a family history of aneurysms,
Yeah.
that's a serious red flag.
Yes.
Wow.
It would be crucial to talk to your doctor about getting screened.
Yeah.
Early detection can truly be life-saving in this case.
And that brings us back to the silent killer aspect. What are the symptoms?
Sure.
Can you feel an aneurysm forming?
That's the tricky part.
Okay.
Many aneurysms never rupture.
Wow.
Some stay small and don't cause noticeable problems, while others grow slowly over time.
Okay.
And unfortunately, many people don't experience any symptoms until it's too late.
So it's like a ticking time bomb, but you don't know if it's set to go off or not.
That's a good way to put it.
Wow.
However, there are some potential warning signs.
Okay.
Deep, constant pain in your abdomen or side
Right.
back pain, or even feeling a pulsing sensation near your belly button. These could indicate a growing aneurysm.
That's important information for everyone to know.
It is.
If someone does experience those symptoms,
Yeah.
what should they do?
So
If they rush to the emergency room.
if you experience sudden, severe pain,
Okay.
especially if accompanied by a rapid heartbeat or dizziness,
Yeah.
seek immediate medical help.
Okay.
It could be a sign of a rupture,
Nah.
and every second counts in that situation.
Okay, that's definitely something to remember.
Yeah.
But what about those who don't have symptoms? What steps can they take to be proactive and catch these aneurysms early?
Regular checkups are essential,
Okay.
especially if you have any of the risk factors we've discussed. Your doctor can assess your individual risk and recommend appropriate screening.
What kind of screening is typically done for abdominal aortic aneurysms? Are we talking about complex and invasive procedures?
Not at all.
Okay.
One of the most common and least invasive options is an abdominal ultrasound.
Okay.
It uses sound waves to create images of your aorta,
Right.
allowing doctors to check for any bulging or weakening.
So it's a relatively simple and painless procedure.
Exactly.
Okay.
And if more detail is needed,
Yeah.
doctors might recommend an abdominal CT scan or an MRI.
Right.
These tests provide even more detailed images of the aorta.
It's fascinating how technology allows us to see inside the body and detect these potential problems early on.
It really is.
We've covered what an aneurysm is,
Yeah.
risk factors,
Right.
and how it's diagnosed.
Mm-hmm.
What about treatment?
Sure.
What options are available?
Treatment really depends on the size of the aneurysm and how quickly it's growing.
Okay.
If it's small and stable, a watchful waiting approach is often recommended.
Okay.
This involves regular monitoring with ultrasounds or other imaging to keep an eye on things.
So like monitoring that tire bulge to see if it's getting worse.
Exactly.
Okay.
But if the aneurysm is larger,
Okay.
typically around 1.9 to 2.2 inches,
Mm-hmm.
or if it's growing rapidly,
Right.
surgery is usually recommended to prevent a rupture.
That makes sense.
Yeah.
And speaking of surgery,
Sure.
what types of procedures are available for treating abdominal aortic aneurysms?
There are two main options.
Okay.
One is endovascular repair,
Okay.
a less invasive procedure.
Got it.
A catheter is inserted through an artery in your groin and guided up to the aorta.
Mm-hmm.
Then a mesh graft is deployed to reinforce the weakened area.
Okay.
Think of it like patching the weak spot from the inside.
That sounds pretty high tech.
It is.
What's the other option?
The other option is open surgery,
Okay.
a more major procedure.
Okay.
In this case, the surgeon opens up the abdomen to access the aorta and replace the damaged section with a graft.
Okay.
It's like rebuilding that section of the highway.
So one is patching the highway from the inside,
Right.
and the other is like rebuilding a section of it.
Yes.
What factors determine which procedure is best for a particular patient?
The choice depends on several factors,
Okay.
including the size and location of the aneurysm, your overall health,
Right.
and your surgeon's expertise.
This is a lot to take in.
It is.
From what we've discussed so far, what would you say is the most important takeaway for our listeners?
I think the key message is that awareness is crucial.
Okay.
Knowing the risk factors and potential symptoms of an abdominal aortic aneurysm can be life-saving.
Right.
If you have any concerns,
Yeah.
don't hesitate to talk to your doctor about getting screened. Early detection and treatment are the best ways to minimize the risks associated with this condition.
For sure.
Yeah. And it's not just about individual awareness.
Right.
What's fascinating is how screening recommendations have evolved over time.
Yeah.
There's been extensive research
Okay.
on the cost-effectiveness of screening various populations.
Mm-hmm.
And guidelines are constantly being refined to ensure resources are used wisely while maximizing early detection for those who need it most.
That makes sense.
Yeah.
It's all about finding the right balance between proactive screening and efficient use of healthcare resources.
Exactly.
We've talked about the seriousness of this condition,
Yeah.
but what about the success stories?
Sure.
What are the chances of survival if someone does have a ruptured aneurysm?
That's a great question.
Yeah.
And it's important to remember that while ruptured aneurysms are extremely serious,
Mm-hmm.
they're not always a death sentence.
Okay.
Survival rates have improved significantly,
Right.
thanks to advances in surgical techniques and critical care.
Yeah.
However, it's crucial to be realistic.
Great.
A ruptured abdominal aortic aneurysm is still a major medical emergency.
Right.
The faster someone receives treatment,
Yeah.
the better their chances of survival.
So time is of the essence.
Absolutely.
What can people do to improve their odds in such a situation?
Yeah.
Are there any immediate steps to take while waiting for medical help to arrive?
Absolutely.
Okay.
First and foremost,
Yeah.
knowing the symptoms and acting quickly is crucial.
Mm-hmm.
If you or someone you're with experiences sudden, intense abdominal or back pain,
Right.
don't wait to see if it gets better.
Okay.
Call emergency services immediately
I do that.
while waiting for help.
Yeah.
Stay calm and reassure the person.
Okay.
Help them into a comfortable position,
Mm-hmm.
but avoid moving them unnecessarily.
Okay.
Keep them warm,
Right.
but don't give them anything to eat or drink.
Those are really practical tips that everyone should know.
Yeah, they are.
It's empowering to know that even in a frightening situation like this,
Yeah,
there are things you can do to potentially make a difference.
exact.
And remember, while we've focused on the critical aspects of abdominal aortic aneurysms,
Mm-hmm.
the best approach is always prevention
Right.
by making healthy lifestyle choices,
Yes.
managing blood
Keep-
pressure,
okay.
and avoiding smoking.
Right.
you can significantly reduce your risk of developing an aneurysm in the first place.
Absolutely.
That's a great point to emphasize. Taking care of your cardiovascular health through lifestyle choices can have a huge impact on preventing serious conditions like this.
Definitely.
We've covered a lot of ground today.
Yeah.
From the basics of what an abdominal aortic aneurysm is to exploring risk factors, symptoms, diagnosis, and treatment options. We've also discussed the importance of early detection and knowing what to do in case of an emergency.
We have.
Absolutely.
It's been a deep dive into a condition that's often misunderstood but incredibly important to understand.
Absolutely.
Yeah.
So, having explored all of this information, what stands out to you is the most surprising or intriguing aspect of abdominal aortic aneurysms?
For me, it's the fact that something so potentially dangerous can develop silently within our bodies, often without any clear warning signs. It's a powerful reminder that we need to be proactive about our cardiovascular health throughout our lives. Not just when we experience symptoms.
I couldn't agree more.
Yeah.
It's a wake-up call for all of us to prioritize our health and be aware of potential risks.
Absolutely.
And to remember that knowledge is power.
It is.
Understanding conditions like abdominal aortic aneurysms empowers us to make informed decisions about our health and potentially save lives.
Well said.
It really is amazing how much progress has been made in both diagnosing and treating this condition.
It is.
What are some of the things that have changed the landscape of abdominal aortic aneurysm treatment over the years?
One of the biggest advancements has been the development of endovascular repair. This minimally invasive technique has revolutionized treatment for many patients, allowing for quicker recovery times and fewer complications compared to traditional open surgery. It's a real game changer.
That's incredible to hear.
Yeah.
So, for someone facing treatment for an aneurysm, what advice would you give them to help navigate this complex medical journey?
I would say, first and foremost, don't be afraid to ask questions. It's your health, and you have the right to understand your condition and the treatment options available. Gather information from reputable sources, discuss your concerns openly with your doctor, and consider getting a second opinion if you feel it's necessary.
That's great advice.
Yeah.
It's empowering to know that patients can play an active role in their healthcare decisions.
Absolutely.
And remember, there's a whole team of healthcare professionals dedicated to supporting you through this process.
Yes.
From surgeons and nurses to specialists in vascular care, you're not alone on this journey. That's reassuring to hear.
Yeah.
And on that note of support and resources, are there any organizations or online communities you'd recommend for people seeking more information or connecting with others who have experience with abdominal aortic aneurysms?
Yes, definitely. Organizations like the American Heart Association and the National Institutes of Health provide reliable information and resources on cardiovascular health. And there are numerous online forums and support groups where people share their experiences, offer advice, and find comfort in connecting with others facing similar challenges.
Those resources can be invaluable, providing both practical information and emotional support.
They can.
Well, I think we've covered just about everything we can on abdominal aortic aneurysms in this deep dive. What final thoughts would you like to leave our listeners with?
I'd emphasize that while abdominal aortic aneurysms are a serious condition, early detection and timely treatment can significantly improve outcomes. Knowledge is power. So I encourage everyone to be aware of the risk factors, stay informed, and prioritize their cardiovascular health.
That's a perfect message to end on.
Yeah.
We hope you found this deep dive into abdominal aortic aneurysms informative and insightful.
I hope so.
If you enjoyed this episode, like, subscribe, and stay tuned for more deep dives into human health. See you next time on Beyond the Microscope.